Hi everyone, my name's Jasmine. I'm a nursing student. And today I'm going to talk to you guys about fetal circulation in regards to the cardiac lecture for pediatrics. This is like a quick lecture going over introduction points for heart problems and heart defects later on. Um, and this one in particular is just about fetal circulation. So, when the baby is in utero, the baby is using the mother's capabilities to breathe. However, the baby has certain things uh, that can help it receive as much oxygen as possible. Because again, when the baby's in the womb, all the organs are very immature because the baby's not using them. And there are a few things that the baby can use to help them get blood flow through their organs. And one of those things is called Ductus Venus. Now, the baby has all four chambers of the heart like a regular person. However, since the lungs are non-functional, uh, it has to get oxygenation some way. And one of those ways is called Ductus Venus. Now, in the umbilical cord of a baby, they have two arteries and one vein. That vein is their ductus venus. And actually, the vein actually is the portion of the umbilical cord that carries oxygenated blood. Now, how does it do that? So, what it does is that the ductus venus, I wish I had a picture. I'm just going to try my best to describe it. So, the ductus venus actually bypasses the liver in red blood cell production um, to get into the circulation. Make sure I'm saying this right. To get to the heart. Now, let me put bypass the liver so everyone knows. Bypass the liver. Why does it do that? Because the liver isn't making red blood cells. Okay, like I said, the baby's getting majority of his blood flow from the mother. But at that point, when the umbilical cord is actually cut during delivery, then blood starts flowing to the liver. Okay. Um, and that promotes red blood cells to start being activated. Now, when is this closed? Usually, it closes immediately, or it closes immediately. The blood flow, and what happens is that ductus venus, that vein that carries oxygenated blood, and actually turns into something that's called ligamentum teres. So, like as an adult, obviously, I don't have my ductus venus anymore. It's actually been transformed into a ligament. Now, for my foramen ovale, it basically means a open hole. Um, this open hole, babies have this open hole in their heart. Because what's going on is that their lungs are immature. So why would someone have a form? Why do infants have foramen ovales? Is because their lungs are immature and they're non-functional right now. And how do you get your lungs mature? You got to use it. But um, if they're in utero and they're not using their lungs, they're non-functional, basically. So what is the purpose of this hole inside of the baby's heart? The purpose of this hole is to promote blood flow systemically to the rest of the body. So this is how it goes. So blood comes in to the baby. It starts at the right atrium. It goes to the left atrium. It goes to the left ventricle. It goes to the aorta. And then it is spread systemically throughout circulation to the rest of the body. Now, when is this closed? Usually it can remain open for a few days. I think lecture said 1 to 3 days. Let me make sure. Yeah, 3 days. 3 days or 72 hours, but it can take up to a week or 2 weeks. Um, Next, your ductus arteriosus. Now, remember I was talking about the umbilical cord has two arteries and one vein. This is deoxygenated blood. So it connects. What it actually does, it connects the superior, the greater vessels, also known as the aorta and the pulmonary artery, together as a whole. All right. So it is the deoxygenated blood, and it is a combination of your pulmonary artery as a whole, sorry, and aorta. Now, when does this usually close? Usually, this is closed uh, when the baby takes his first breath, usually, or it can take up to 3 days. So things that we should know. Make sure I got everything. So again, with this too, I forgot to mention the ductus arteriosus is not only just deoxygenated blood, but it's also oxygenated blood. Because why? You have your a from because this is occurring. Okay, you're going from your right atria to your left atria, and that blood is coming through the baby's aortic artery, and then you have this ductus arteriosus, and then literally, um, in for your heart, for a baby's heart, I'm gonna do this for color purposes. So the aorta is usually oxygenated blood, and the pulmonary artery is usually deoxygenated blood. So if a baby, when the baby has the ductus arteriosus, and due to this way of circulating oxygenated blood right here, there's a hole in between there. So that pulmonary artery is not only getting oxygenated blood, but it's also getting deoxygenated blood. So things that we should know as nurses, our nursing knowledge. We should know that babies' lungs are immature. We should know that they require more O2. Why? Because they're immature and they have a higher metabolic process than we do because they're growing so rapidly. So not only do they have a high O2, they have a higher heart rate. The average adult heart rate is 60 to 100. Infant is 110 to 160. Additionally, immature, increased O2, increased heart rate. Oh, they have a weak heart muscle. And you can guess why. They have a weak heart muscle because in order to, even when you work out, uh, in order to make a strong muscle, you have to work it out. They've been in a environment that does not require stress on their heart. So when they come out, their heart muscle is very weak. Make sure I got everything. So because their muscle is very weak, they're going to have an increased sensitivity to blood pressure changes, to include volume problem, volume overload. Okay. Yes. Um, so that's it. So this is the introduction into fetal circulation in regards to cardiac lecture for peds. I hope you learned something, and I hope that you comment, subscribe, and when you take care of the day, tell me how you did. Bye.